Welcome back to the news tonight. Let's just get you a reminder of our top story we're tracking tonight. Chief Minister Jayalalitha today has announced that a 4 lakh rupee public insurance health scheme, a project that will benefit the people of Tamil Nadu, will be launched soon. This will in fact replace the 1 lakh health insurance scheme by the earlier government. Take a look at the highlights this time.
Out with the old and in with the new. The political game of one-upmanship in Tamil Nadu continues. The AIADMK government has raised the ceiling amount to 4 lakh rupees, up from 1 lakh of the earlier DMK regime. Jayalalitha has also said that the government hospitals will be improved to facilitate better health care. The scheme will cover 950 treatments as against the 642 treatments under the scheme of the earlier regime.
But the scheme will be temporarily useful. Temporarily, it will be a very big relief for the poor. But these health insurance schemes, what they are telling us is, our society, our system is moving towards health care system based on health insurance. That is not at all good. So we have to think of that. So first of all, the government should improve the basic sanitation, basic health care system of the public hospitals and medical college hospitals. Then the poor can get all the treatment free of cost and they will get quality medical care.
ரோஜனை இருக்கமானா நாங்க அந்த கார்டு எடுத்துன்னு போனவனே முதல்ல ஆக்டிவேட் பண்ண மாட்டேன்றாங்க. நீங்க இங்க போங்க, அங்க போங்க, இங்க போங்க. ஒரு half an hour கழிச்சு சுயநல இழந்துறாங்க. நீங்க இப்படியே பண்ணிட்டு இருந்தீங்கன்னா நீங்க முதல்ல பைசா கட்டுங்க, இது அப்புறமேட் பார்க்கலாம்ன்றாங்க. உடனே வந்து ட்ரீட்மென்ட் ஆரம்பிக்க மாட்டாங்க. அதனால இது வந்து எங்களுக்கு யூஸ்ஃபுல்லே இல்ல.
அரசாங்க ஆஸ்பத்திரியில வந்தாலும் அந்த மாதிரி பண்றாங்க.
அரசாங்க ஹாஸ்பிடல்ல இல்ல. அரசாங்க ஹாஸ்பிடல்ல வந்து முதல்ல போனவனே ட்ரீட்மென்ட் ஆரம்பிச்சிட்டாங்க. இன்னைக்கு போய் சேர்த்தோம்னா இன்னைக்கு நைட் ஸ்கேன் எடுத்து பார்த்துட்டு எப்படி இருக்கு பார்த்துட்டு கொஞ்சம் நார்மலா இருக்கிற மாதிரி தான் மறுநாள் ஆபரேஷன் பண்ணாங்க. ரொம்ப சீரியஸ் கண்டிஷன்ல தான் அப்பவே ஆபரேஷன் பண்ணி அப்பவே எல்லாமே கொண்டு போறாங்க. ஆனா பிரைவேட்ல வந்து அந்த மாதிரி கிடையவே கிடையாது.
Some treatments may work only at the government hospitals. Jayalalitha has said that the government scheme will pay for follow-up treatments and will include children.
கவர்மெண்ட் ஹாஸ்பிட்டலில் வந்து நடக்கிற ட்ரீட்மெண்ட் அவங்க கொடுத்தா கூட அதுக்குண்டான வசதிகள் அங்கே இல்லை. அவங்க வந்து நல்லா ட்ரீட்மெண்ட் பண்ணுறாங்க, இருந்தாலும் அந்த பேஷண்ட் வந்து படுக்க கொள்ள ஒரு வசதி இல்லை, ஒரு காற்றோட்ட வசதி இல்லை.
Insurance scheme will be more beneficial and better for the poor patients who are benefited more than the previous ones.
The new scheme with a better ceiling and covering more treatments is definitely a welcome step for people who cannot afford quality health care. However, strengthening of the public health systems is also the need of the hour. In Chennai with Peer Mohammed, Natasha for NDTV Hindu.
Let's now just draw up a comparison for you in some graphics. Soon to be passed, this new public health scheme will cover expenses of up to 4 lakh rupees, a cover for 4 years, and will include 950 treatments. Now, this is in comparison to the 642 treatments offered in Karunanidhi's regime in a scheme that offered to cover 1 lakh for 4 years to poor families. While Ammar's scheme covers tests, surgical, non-surgical treatments, post-operative care and infant care, Karunanidhi's scheme, however, did not cover investigations for diagnosis for ailments. Not just that, this facility can be availed at not just the private hospitals, but also the government hospitals. Joining us for more of an in-depth analysis of this scheme is our principal correspondent, Peer Mohammed. Peer, it looks like the loopholes of the previously launched scheme have been plugged this time around.
Evelyn, that may be correct because there have been two major criticisms about the Kalaignar insurance scheme. One is that the insurance scheme was depending on a private health insurance company, that is Star Health Insurance, and all the money was going to that health insurance company. That was the criticism by the then opposition. And the ruling ADMK during the course of their campaign for the assembly elections were saying that they will review and revise the scheme, and they had said that the money will go to a public health insurance company owned by a government. And also another major thing was the upper ceiling in the earlier scheme was just 1 lakh rupee. Following criticism, the DMK regime also made some flexibility there, allowing up to 1.5 lakh for major surgeries like heart surgeries in exceptional cases. Now that for the new public health insurance scheme announced by Chief Minister Jayalalitha has an upper ceiling of 4 lakh rupees over a period of 4 years, and it will also allow for a flexibility of up to 1.5 lakh rupees per year. That is going to help life-saving surgeries like heart surgery and other kidney related surgeries. That will be taken care of by this new scheme. That is one thing, and also, as you rightly pointed out, the diagnosis part of the treatment also will be taken care of under this scheme, which was not earlier included under the Kalaiñar Health Insurance Scheme. That way this is going to benefit, and also the post-operative care and the inclusion of children under the scheme is going to help the poor. That is what the doctors are saying, and also the focus on the government hospitals is something people are welcoming, because the earlier it was the focus was on private hospitals, a network of private hospitals, and as the one person who spoke to us at General Hospital in Chennai has pointed out, when they go with the insurance scheme card, they were not respected in private hospitals as the ceiling was very low. The maximum that they can spend is just 1 lakh rupees. Now that with the increased ceiling, they might find more respect in private hospitals, as 4 lakhs. The maximum amount is reasonably good when it comes to several kinds of treatments. Evelyn?
Right. We are still to hear from the government about the total expenses during the budget for this. But is that also slated to be much more of money as well for this project this time?
Yes, definitely. Earlier, the premium given by the Tamil Nadu government to the private health insurance company was less than 500 rupees. And now the premium will go up to over 1,000 rupees. That is what we are hearing. And the allocation is also going to be high this time for this public health insurance scheme. And they already have 2 people on the planning commission, state planning commission, Dr. V. Sonda of Cancer Institute and Dr. Sridhar in the planning commission, so that there is more focus, more attention on the public healthcare system in the state. And as stated by Chief Minister Jayalalitha, they are going to improve the facilities in the government hospitals so that they need not go out for treatment. And many of the life-saving surgeries are to be included under the present scheme, public health insurance scheme. These are going to, in fact, benefit in the long run the public health system in the state.
Right. Also, Pete, if you can give us a sense of what strata of people can really come in and use the scheme. Are the conditions similar to the previous one as well?
Yeah, looks like, because those who are coming under the scheme will be the people living below poverty line, because that was the earlier standards, also earlier criteria. The same criteria is likely to be followed, because they are looking at more people from the unorganized sector, because the state economy being the most diversified one and more people going into the unorganized sector, they will be covered. That is what the earlier government was also doing. The same people living below poverty line and people in the unorganized sector are going to be covered under the scheme. That is what we are told by the government sources.
Right. Thanks very much indeed, Pete, for joining us with those details there on that big announcement that came in today from Ms. J. Jayalalitha, the brand new scheme that has lots more additions than the last time. Now, just to get you some news that's coming in, NDTV Hindu does have information that the Tamil Nadu Pollution Control Board has issued closure notices to Chennai-based Orchid Chemicals. This has been ordered as they are believed to have failed to comply with the solid waste management guidelines, and that's a story we will keep a close watch on throughout this evening as well, and try and get you some more updates as well. We'll slip into another short break, but back with more news and updates.